Well, accessibility to healthcare, a shift in focus for providers, and future jobs in healthcare, all topics at the first Changes in Healthcare Town Hall meeting held this week at Ivy Tech's Lawrence campus. The event, the first in a continued series of interactive discussions that will be hosted by Community Health Network and Inside Indiana Business. Away from the town hall, I sat down with Community Health Network President and CEO Bryan Mills and Anthem's Dr. David Lee to talk about some of the implications of America's evolving healthcare system. And joining me now in studio for an in-depth conversation on the dramatic changes in healthcare are Bryan Mills, President and CEO of Community Health Network, and Dr. David Lee, Vice President at Anthem. And gentlemen, welcome to the program, as always. Bryan, in terms of and we mentioned the Town Hall series that we've started, and we're so proud and excited to be partnering with you on that. Why do you think this community conversation, if you will, is important when it comes to healthcare reform?
Well, Gary, first of all, thanks for your partnership. We really appreciate that. And we think it's important because healthcare has always, and we believe will always, be delivered and decided locally. We honestly don't think that the government's going to send down something and this is going to be the playbook. And so we saw a need because there's so many unanswered questions. How does it affect me? How does it affect my parents? How does it affect my kids? How does it affect this line of business? That we thought this is an opportunity to start bringing together employers and social services organizations, the government, insurance companies, and ourselves to say, let's have some dialogue. Yeah. And let's hear what the concerns are, because we've got to redesign a system to meet the patient's needs. We know that. And we need everybody's input to help us do that.
I'll ask you both this question, you first, Bryan, but in terms of that education process, been talked about for a long time, where do you think consumers and businesses alike, still a lot of questions, where are they in that situation in terms of understanding really what's happening and what's about to happen?
Well, Gary, my feeling is that we believe there's some bill, and I know this is somewhat repetitive what I've just said, that's going to define this. I honestly don't believe that. Our issues related to healthcare are the demographics of our population. We have an aging population. It's largely funded by the government now. The funding is driving all this change. And so if we understand the fact that we've got to do this with or without a bill, then all of a sudden we get back to, okay, what's the practicality of this? And as a healthcare provider, we believe people should have access to healthcare. We want to allow you to get into our doors however or whenever, whatever you need, and then to help you navigate that, and then improve our communication systems to help you and all of your providers work as a team, because right now we don't work as a team.
Yeah, David, it would seem that businesses maybe have gotten the message to an extent, because I know we've done a lot of stories about companies really getting engaged in preventative health and wellness and those types of things, understanding that they impact their bottom lines.
Absolutely, Gary. I think there's some great stories around the state and around the country of employers that have instituted programs that really improve the health of their employees. I think the difficult thing with preventative health, however, is there isn't really good information to show that, for instance, having an annual screening mammogram for the appropriate patients really saves the healthcare system money. And intuitively, we think that it probably does because you catch breast cancer at an earlier stage. But that's where kind of business meets medicine and sort of the complexity of the issues that the town hall will address.
You mentioned information, and information technology is such an important part of healthcare today and will be going forward. As you look at information technology and the role it can play, whether it's in the insurance sector or wherever it is, how important will technology be to healthcare going forward?
I think it's enormously important, Gary. I think you asked the first question about businesses, and businesses are driven by information. Unfortunately, in healthcare, the information isn't always reliable or timely to make healthcare decisions. And so I think embracing information technology is critically important. I'd like to just toot Community's horn that they have on a mobile app where you can actually look at the wait times at their urgent care centers and know what your wait time will be if you go to an urgent care center, and then actually schedule an appointment there. That's the sort of innovation that I think is critical.
Talk about a little bit more about that, Bryan, because I know Community has been very focused on technology and information technology for quite a while now. will technology be an enabler for better, improved access to health care for consumers and businesses alike?
Undoubtedly, Gary, but there's a misnomer there. I think a lot of us believe, and me included a few years ago, would say, we just need to digitalize or make everything electronic. Well, that doesn't help anything. We've got to make sure that whether the primary care physician or the urgent care facility or the cardiologist or the nursing home facility or the insurance company, we're all working off the same information. And so we need to have it not only in something that's transportable, but where people are using that and it's real time, because that's not what we have. And so we've got a lot of efforts underway to make sure that we not only make this electronic, but we make it useful and functional by everybody off the same patient chart.
Yeah, and it's accurate to say, I think, that Indiana as a state, with the Indiana Health Information Exchange and the participation and cooperation of hospitals, I think, around Indianapolis and Indiana, really maybe kind of ahead of the curve a little bit in that regard.
Well, I think it's really a testimony to the health systems here as it pertains to a number of things, but two in particular, that being the exchange of information and a patient's safety, that we don't compete, but we collaborate. And we're openly trying to do that to show that we've got the patient's best interests in mind. And I think that's really a platform that we can build a lot off of.
Dave, in terms of businesses, and certainly a number of, well, all businesses, but small companies, some have eliminated providing benefits. Others have scaled back to the basic level. Are there things that companies need to keep in mind or think about now as they're crafting their benefits packages?
I really believe, Gary, that it's a matter of creating a competitive environment within the healthcare marketplace and giving the associates of those small businesses the information so that they can make the right choices regarding their own health care, both in terms of quality and cost effectiveness. I think that that's just a crucial element of improving the delivery of health care.
Yeah, and back, Bryan, I'll end with you too in terms of that education piece. I think consumers, businesses certainly are, I think, but do you think consumers are better educated now about health care? And if so, will that play a role in making things better?
I think that there's improvement in education, but I also believe that there's so much clutter out there. It's where do I go and what do I trust? And I still believe it's incumbent upon us, in working in cooperation with the others that are participating in these town halls, to really say, we're going to be the credible source, that we can work together and you can know that we have your best interests in mind, and if you work with us, we'll work with you.
All right, very good. Bryan Mills, David Lee, thank you both for some great perspective. Look forward to talking with you much more on this in the weeks and months ahead. Thank you.